Good evening. You are tuning into AWANI Tonight with me, Farhana Che. Prime Minister announces 40 billion ringgit aid package. And how can we take care of our mental health during times of uncertainty? That's coming up. Prime Minister Tan Sri Muhyiddin Yassin has announced an additional strategic program to empower the people and economy, also known as the Pharmaceutical Plus. This 40 billion ringgit package aims to elevate the burden on those affected following the decision for a full lockdown, which is scheduled to start tomorrow. Other than the Bantuan Prihatin Rakyat cash assistance, Muhyiddin also announces moratorium for bank loans, the extension of the wage subsidy program, Gerakan Khas Prihatin for businesses, and one-off assistances for certain groups of workers who are in the affected sectors. He also announced a 1 billion ringgit allocation focused on increasing capacity and fortifying our public health system in the fight against COVID-19. The allocation is meant for increasing bed capacities as well as ICU equipment, operational costs, procurement of medicine, and the extension of some 14,000 medical officers and nurses under contract now until 2022. For more details, do stay tuned to Astro AWANI for our comprehensive coverage on the Pharmaceutical Plus package. Now we have on the line Professor Tan Sri Dr. Noor Azlan Ghazali, Executive Director of the Economic Action Council, to share his insights with us on Pharmaceutical Plus. Tan Sri, we see there are a number of initiatives underlined under the Pharmaceutical Plus. Will it be able to sustain all those affected during this full lockdown?
Hello. I think the package just announced by the government, by the Prime Minister, is quite comprehensive in the sense that most of it is actually extending some of the packages targeted for the SMEs before this. And I'm glad to hear that on the wage subsidy, on the direct cash support to the businesses, as well as various other non-monetary injections, basically, some leeways given by SSM and LHDN. I think that will help the SMEs at least to face these the first 2 weeks of the full lockdown.
Tan Sri, what about SMEs that are badly hit each time a lockdown is initiated? How can they position themselves to be more resilient? Are the assistance given enough?
Well, basically, there are two dimensions of it. Every time there's a lockdown, definitely first is about the cash flows of the SMEs. That's why, as has been announced by PM, most of these packages are about the immediate impact in terms of the cash flows to allow the SMEs to sustain their operations. But simultaneously, I think in the previous packages as well as in the budget last year, that was announced last year, SMEs must make some adjustments in the sense that to digitize their operations, to be able to continue their operation despite we might have to lock down whenever the pandemic is getting worse. So I think the digitalization is the most important part of the SMEs, and also in terms of formalization of their businesses. And where possible, I believe that there are entry and exit in this sector, and it would be good if government creates a platform for the entry and exit to be facilitated.
Thank you, Tan Sri, for your time and insights. Moving on, the National Pharmaceutical Regulation Agency, NPRA, is assessing the suitability of using the Johnson & Johnson COVID-19 vaccine. Coordinating Minister for the National COVID-19 Immunization Program, Khairi Jamaluddin, said the one-shot US-made vaccine, once approved, will be used among undocumented migrants in Malaysia. In March, he expressed concerns about the availability of the vaccine, saying that Johnson & Johnson only offered some 2 million doses to Malaysia and would only be able to deliver them towards the end of the year. In other news, Khairi said vaccine registrations have picked up due to greater awareness and concern about the surge in COVID-19 cases. Some 12.1 million people have registered, which makes up close to 50% of the nation's population of those aged 18 and above. However, despite the surge in registrations, Khairi said attendance for appointments still remained at 80%. Those who did not turn up for their appointments said their absence, among others, was due to no transport or arriving late. Not all private medical practitioners want to take part in the country's vaccination drive. Khairi Jamaluddin said this when asked to comment on the lack of participation by private healthcare operators, adding that only about 2,500 GPs have signed up for the vaccination exercise to date. He said other than the limited number of registrants, the GPs also have to go through training and have the adequate equipment to store the vaccines in a cold chain system. 2,467 private medical practitioners had registered for the vaccination drive, and of those, 1,665 had undergone training. Yesterday, Khairi said a total of 1,000 clinics would be designated as vaccination centres by June 30th, estimated to administer up to 40,000 doses a day. Mobile COVID-19 vaccination trucks will be used to vaccinate residents of Kuala Lumpur, particularly in areas with high number of cases. Khairi said this after discussing the matter with Federal Territories Minister Tan Sri Anwar Musa about implementing the pilot program in Kuala Lumpur. The program will begin at People's Housings Project or PPR and construction sites that are allowed to operate during the MCO. The government aims to deploy 30 mobile trucks, each conducting up to 100 vaccinations a day. Khairi said the mobile trucks will also be considered as a method to vaccinate refugees in Malaysia. We'll take a short break. Stay with us.
Hi Astro Movie Spec customer, are you ready to stream Disney Plus Hotstar with Astro starting 1st June? Your Movie Spec subscription will include Disney Plus Hotstar for just 5 additional ringgit. Outstanding. Cepat, follow these steps to enjoy your entitlement. First, create your Astro ID at astro.com.my/astroid and secure your account by inserting your IC and smart card number for this. Mana nak dapat smart card number? Sini. Klik verify and done. Sabar. Hari yang ditunggu-tunggu sudah sampai. Visit astro.com.my/Disney, log in with your Astro ID to activate your Disney Plus Hotstar. Here you will be asked for your mobile number. Key in your mobile number and voila! Activation success! Finally, download Disney Plus Hotstar, log in with your mobile number and you can start streaming immediately. Senang, sangat senang! Not a Movie Spec customer yet? Subscribe today.
Welcome back. With no end in sight to the pandemic and the implementation of the third movement control order, many Malaysians are grappling with loneliness and even suicidal thoughts. How do we better take care of our mental health during long periods of uncertainty? Wrapping up Mental Health Awareness Month, we speak to R.D. Ayadali from Befrienders Kuala Lumpur on looking out for ourselves and others in these tough times.
So calls have been on an increasing trend, especially during MCO 3.0. So if you want to compare to the first MCO, on average, we receive around 70 calls per day, but now it has gone up to around 107 calls per day. So that's more than a 50% increase. And reasons for calling have been consistent, so mainly because of mental health related issues, relationship and family issues. However, we have also noticed an increase in calls with regards to financial and job issues. And also due to MCO, there are more callers expressing their loneliness due to isolation caused by MCO and their inability to see family members and friends.
RD shares a few tips on how to cope mentally during the COVID-19 crisis.
While staying updated to the news is important, it's also crucial to take breaks from them, especially those on social medias. It's good to be informed, but hearing about the pandemic constantly can be quite upsetting. And then secondly, you need to take care of your physical health also. So you can do this by eating well-balanced meal, exercising regularly, getting enough sleep, and avoid excessive intake of alcohol, tobacco, and substance use. And thirdly, and most importantly, connect with others. Talk to people you trust about your concerns and how you are feeling, because it's really important to ventilate what you are experiencing and not just keep everything to yourself.
Befrienders says there is a greater urgency to decriminalize attempted suicide, especially with increasing mental health cases induced by COVID-19.
The first thing that needs to be done is to decriminalize suicide. A lot of talk has been going on for the past few years about this, and the ball has been rolling, but it stops short from being implemented. And it is not right to actually punish those who attempted suicide with prison time or fines, because what they really need is professional help and support, as a high number of these people who attempted suicide are suffering from one or more mental illness or mental health related issues.
RD says being compassionate and empathetic go a long way in supporting those suffering from mental health problems.
Let us be more empathetic and supporting, especially if we have friends or loved ones who are suffering from mental health issues and feeling suicidal. Let's create more awareness so that people know that mental illness is real, and people who are suicidal are not attention seeker, but they are in a lot of pain and they just want that pain to end, and suicide is the only way that they can think of. And most importantly, to those who are actually suffering and feeling suicidal, you need to know that help is available, depression is treatable, and suicide is preventable.
On to the international front, Vietnam plans to test the entire 17 million population of Ho Chi Minh in response to a fresh outbreak in the city. The move came after Vietnam's health ministry said it detected a suspected new coronavirus variant, which appears to be a hybrid of the two highly transmissible UK and India strains. Vietnam has had relative success in controlling the virus, but cases have been rising over the past weeks. Over the weekend, officials warned of a new dangerous hybrid variant discovered in the country that combines features of the variants first identified in India and the UK and is easily transmissible by air. Overall, the country has registered just over 7,000 infections and 47 deaths, but the latest spike accounts for more than half of the total number of cases. The latest outbreak in Ho Chi Minh City is centered around a religious mission which had seen at least 125 positive cases. China announced that it will allow each couple to have up to 3 children, marking an end to a strict two-child policy. The decision came after its latest census showed that China's population grew at its slowest pace in decades. This added pressure on Beijing to boost measures for couples to have more babies and avert a population decline. Earlier this month, China's once-in-a-decade census showed that around 12 million babies were born last year, a significant decrease from the 18 million in 2016 and the lowest number of births recorded since the 1960s. In 2016, China scrapped its one-child policy initially imposed to control its population with a two-child limit. But it failed to result in a sustained surge in births as the high cost of raising children in Chinese cities deterred many couples from starting families. Amid renewed calls to reconvene Parliament, tonight on Consider This, we ask our guests if a functioning Parliament will help with the effective management of the COVID-19 crisis and what obstacles are in its way. That is all we have for you on AWANI Tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Farhana Sheikh. We'll see you again.